Alright, so welcome to Module 15. I'm going to try to do this without coughing, but it's not going to happen. So this module is really important to you guys because this is going to be something that you will need to be very aware of as you go into your final project. Just FYI, I will post your final project tomorrow. Your final project will be due to me on Monday by midnight. So, Module 15, your role in caring for most common diseases that we see at home. The objectives, you guys can all read. Identify sources of payment for home care. Understand the cost savings of home care versus institutional care, which we've touched on a little bit. Recognize most common diagnoses related to home care. This is where you need to study. Gain an understanding of diseases and or conditions most commonly seen in the home. Understand the home care aide's role in caring for patients with certain diseases and conditions. So this module gathers data from lots of agencies. It includes home health, home care aid organization, and hospice. So Medicare continues to be the largest payer of home health care services. Medicaid covers a lot, but it includes in-home services that Medicare doesn't cover, like for a personal care aid to help in the home. Other payer sources include state and local governments, private insurance, and out-of-pocket. So 12 million people receive some sort of home care. The latest projections are from 2009, and the projections of expenditures for home care were expected to be $72.2 billion, not million, billion dollars. While the Center for Medicare and Medicaid Services can keep track of agencies and costs for those who utilize their payment methods, a lot of agencies don't bill Medicare and Medicaid. Therefore, keeping track of non-certified agencies is very difficult. This means that there's little data that exists for comparison from certain agencies versus non-certified agencies. So someone who bills Medicare and Medicaid, it's very difficult to get information from a private entity. So Medicare continues to be the largest payer of home health care services. Of the estimated $72.2 billion in expenditures, Medicare expected to pay approximately 41% of those costs. So if you think about it, you get paid $100 in your paycheck. That's what you were expecting. But you ended up only getting 40 because the government said we were taking the other 60. That's very similar to how this functions. So Medicaid covers a great deal of expenses as well. It covers in-home services that Medicare may not cover. It's estimated that Medicaid will cover another 24%. So the remaining payer sources include state and local government, your tax dollars, private insurance, and money that comes from the patient out of pocket. Alright, so some common diseases in home care. So hypertension affects tens of millions of people and contributes to death from heart and kidney disease. Treatment for hypertension does not cure it, but controls it. Blood pressure for someone to be considered hypertensive is over 140 to 150 over 90 to 100. That's diastolic over systolic, and that's considered hypertension. So what happens if your grandmother goes to the drugstore, puts her arm in the machine, and she gets an elevated blood pressure one time? That is not considered hypertension. You have to have readings over an extensive amount of time. So hypertension is called the silent killer because it gives no warning in its early stages. As the disease progresses, it may cause headaches, vision changes, problems with urinary output, permanent damage to vital organs. A lot of people don't seek medical help until they've had a stroke. There's a higher risk of hypertension if the following: history of hypertension in your family, heart disease or kidney disease, smoking cigarettes, being overweight, high salt intake, being African American, high saturated fat diet. Some causes are still unknown, but those causes may include diet, hereditary, taking birth control pills, kidney infections, and chemicals. So what is your role with the hypertensive patient? It's always important to follow the plan of care for the patient and help them comply with their medicine, their diet, and exercise. If they're not compliant, you need to let somebody know. Help the patient incorporate his or her treatment into his or her daily routine, so taking your medicines at a regular time. That makes it part of your normal day. Listen to the patient. That's a big thing because oftentimes we don't listen. Watch for possible side effects from medications and report those immediately. Some of those can be stuffy nose, muscle cramps, weakness, nightmares, and for men, the inability to have an erection, which is also called impotence. The next disease we're going to talk about is a heart attack, which is called medically a myocardial infarction. There are many medical reasons, but all result in a decrease in blood supply to the heart. If heart tissue dies as a result, it is called a myocardial infarction. Recovery of the heart depends on the location of the infarction, which means tissue death, the person's age, their gender, atherosclerosis, and the patient's health history. Atherosclerosis is the hardening of the arteries, which leads to a decrease in the blood supply to body tissues due to thickening of the blood vessel walls. That can result in a buildup of fatty plaque and lead to complete obstruction. Atherosclerosis is the first stages that can be reversed, but once the vessel's blocked, it's very hard to unblock if it's able to be unblocked at all. So what's the home care's aid? Home care aid's role. It involves helping the patient formulate a plan of care and sticking to it. But to know that, you have to know the type of heart attack the patient had, what has their recovery been up to this point, what is their home situation, and what's the prognosis. The plan of care will also include instructions about their activities, their diet, their medication, and if there's any emotional support. So many people become a cardiac cripple because they're afraid of another heart attack if they exert themselves, which then leads to decreased exercise, high cholesterol because they're eating and not moving. They need encouragement to do some of their care and follow an exercise program. The patient may also show a total disinterest in their condition. They don't take their medicines and they don't follow the medical plan. This is considered denial of their condition. So angina or angina. So this is a brief temporary pain or heaviness in the chest brought on by stress or physical activity, results from a lack of oxygen to the heart, which equals a change in the patient's angina signals, a change in the cardiac status, and it should be reported. Again, this is something that you have to think about if somebody is over the age of 30 and they have other risk factors. Causes of angina can be narrowing of the coronary arteries, which bring oxygen to the heart. It's not a heart attack, but it can lead to one if it remains untreated. Risk factors include high blood pressure, high cholesterol, being overweight, smoking, and a high stress level. Treatment options can include medications, which increase flow of blood to the heart, control of risk factors, which means altering your lifestyle, and possibly having surgery. So angioplasty is what is done to increase the size of the arteries in the heart. So what's the home care's aid? What is the home care aid's role for a patient with angina? You have to help support the family and the patient to follow the plan of care. Dwell on successes and not failures, and encourage your patient to return to a very healthy activity. Watch for stressful situations that may be aggravating your patient and help them to deal with that. Report any and all complaints of chest pain to someone above your level. So interestingly enough, a patient may take a pill called nitroglycerin. It's a tablet that goes up under the tongue, which is called a sublingual tablet for those of you taking the pharmacy tech class. If you see a patient taking this medication, ask them about their chest pain and if that nitroglycerin makes it better. If it does, you're probably getting ready to need somebody to help you. So let's talk about diabetes, which is another common disease that we see in home care. It results when the pancreas does not produce enough insulin to break down carbohydrates. You guys all probably know somebody that has diabetes. This results in a decrease of starches and carbohydrates being used for energy, and it's absorbed by the cells. Sugar remains in the bloodstream and is then excreted in the urine. This results when the pancreas does not produce enough insulin to break down carbohydrates in the blood. So the types of diabetes, there are 3. Insulin dependent, which is type 1, or called juvenile diabetes, and it occurs in the young and is usually seen before age 36, usually a lot younger. There's non-insulin dependent, which is called type 2. Maturity onset, which is older onset because it occurs after the age of 36. And more than 80% of all people have type 2 non-insulin dependent diabetes. Gestational is type 3, and it occurs while a woman is pregnant. Blood sugar usually returns to normal after she delivers. And then sometimes they say that there's a type 4, which is really from unknown causes, but it can be from hormone treatments for women or for steroid use for people who have respiratory problems. Signs and symptoms usually come on slowly. Testing is done periodically for early diagnosis and treatment. Blood samples, blood is taken from the arm and checked for the amount of glucose that's present in the bloodstream. The normal range for blood glucose is 80 to 120 milligrams. We can also do a urinalysis. The urine is checked for spilling of glucose, which is sugar, into the urine. Glucose tolerance test is for pregnant women, and it's a test done on the urine and blood after they're given a certain amount of glucose. Long-term disorders of diabetes, blindness from cataracts, glaucoma and possibly hemorrhages, gangrene from poor circulation, skin breakdown, and invasion of tissue by bacteria, kidney disease from too much sugar in the urine, vascular disease and nerve degeneration caused by high sugar levels, poor fat metabolism, poor tissue repair, and poor circulation. So what's the role of the home care aide for the patient with diabetes? You have to help the patient make adjustments to live with the disease and follow a medication and diet routine. Notify a nurse or a dietitian if the patient's having difficulties following a plan. Assist with medication reminders. Never give an injection or oral medication because you cannot. Insulin should be stored in a cool location away from heat and light. Observe patients during a blood sugar check to make sure they understand how to do it. And patients with diabetes oftentimes have a harder time healing due to poor circulation. So you need to observe the skin for early signs of skin breakdown. If a patient with diabetes has vision problems, assist them with doing activities of daily living. Observe nails and toes for infection or pressure areas. We never cut toenails or fingernails in a diabetic patient. Encourage your patient to wear an ID tag or bracelet which includes their name, address, phone number, medical condition, and any known drug allergies. Patients with diabetes, when their blood sugars go really high, over 5, 6, 7, 800, or really low, down in the 20s, oftentimes become very fightful, where they'll fight you when they're angry, or they become very mean, or sometimes they just become comatose. So a CVA, or a cerebrovascular accident, also called a stroke. So a stroke occurs when the blood supply to part of the brain is stopped due to a blocked blood vessel. The result of a CVA depends on which blood vessels are blocked and which brain center is destroyed. The results of a CVA may be paralysis, loss of speech or vision because nerve impulses don't reach the brain due to damaged brain tissue. Collateral circulation sometimes will take over the circulation for the damaged blood vessel and supply blood to the injured brain tissue. So for example, if you have an aneurysm in your brain and it's small, sometimes other areas of the brain will take over that function. So some causes of stroke can be an emboli, a blood clot which forms in the body and travels to the brain. A thrombus is a blood clot which forms in the brain and blocks the blood vessel. Plaque, if you think about it, we just talked about that with your heart, accumulates in the blood vessel and will close it, but this type of plaque is in the brain. Hemorrhage or an aneurysm, a blood vessel will actually burst, and that is typical with people with high blood pressure. So what is your role in taking care of somebody? So you have to be very alert to patients' changes. It's impossible to predict when or if a function will return, and you can't compare one patient to another or someone you know to somebody else. Provide personal care, which follow the instructions for the physical, occupational, or speech therapy. Prevent complications. Watch for proper nutrition and help with proper nutrition. Provide for safety. Emotional aspects of the chronic condition for the patient and or his family. As you can imagine, this can be very debilitating. The home care aide helps the patient plan a daily routine. Arrange for activities so the patient doesn't tire. Give positive encouragement on progress. Show patience and understanding and be an active listener. Do exercises to help the patient regain or maintain the function that they have. Assist patients in taking their medication. And if someone tires the patient, you have a responsibility to help your patient by asking the person to allow them to rest. So let's talk about the next one, which is very common. It's arthritis, which is inflammation and destruction of joints. Most often affects shoulders, ankles, elbows, wrists, fingers, and toes. Arthritis can be due to an allergy, an injury, or an infection. It can also be due to surgical intervention, which is called an insult, which is also called an injury. Some of you do not think about surgery as an injury to the body. So there are over 100 types of arthritis. The most common are osteoarthritis. It occurs among the elderly, and after continual use, the joints and their linings become thin, bony surfaces become thick and develop spurs. The bones rub against each other, causing pain and inflammation. Rheumatoid arthritis, on the other hand, is a crippling chronic disease, and all of the connective tissue in the body is affected. It usually starts in young adulthood or childhood, and it's 3 times more common in women than in men. So, ankylosing spondylitis is more common in men than in women. It may start in childhood, but almost always before the age of 35. The disease attacks the spine, shoulders, and hips, and these patients usually remain stiff, but they're able to function and lead normal lives. Gout is more common among men. Uric acid crystals build up in the blood and lodge in the joints, and it causes inflammation and extreme pain. Any joint can be affected but the big toe is the most common site. So what is your role in helping somebody when they have arthritis? It's a chronic condition, and you have to help patients establish a safe, efficient, and routine and decrease muscle stress and fatigue. So you encourage exercise and then intermittent periods of rest. If the patient is trying an unconventional treatment for arthritis, you need to let someone know this. A lot of our patients take over-the-counter medications because somebody told them that it would work, and oftentimes it doesn't. The best thing you can do is listen to the patient and then share those conversations if you feel like the patient needs some additional help. So chronic obstructive pulmonary disease, also called COPD, refers to all diseases that cause irreversible damage to the lungs over time. One of the leading causes of death in the United States. Asthma and emphysema are 2 common types of COPD. These patients have difficulty performing any activities which require exertion. They must also learn to live with equipment to help them breathe, such as oxygen or a nebulizer. So what is your role in helping them? So you have to help them by encouraging rest. And the person who's the primary caregiver can get very tired because these patients can't really do much for themselves. The primary caregiver needs respite care, so they get a break. Encourage the caregiver to take care of personal needs or leave the home if you're there. Encourage the patient to take or use his medications. Report any behavior changes because prednisone is what is given to most COPDers, specifically those who've had asthma or emphysema, and prednisone can make you really mean. Encourage patients to eat small, nutritious meals. Believe it or not, patients who have trouble breathing also have trouble eating. Because if you think about it, when you eat, you breathe. The act of eating is work. Help the patient to occupy their time and encourage them to be in a bed that's raised straight up at 90 degrees, which is called Fowler's position. Warn the family about smoking and the use of oxygen. There should be no smoking around these patients, and they need to keep the home dust-free as possible. Let's talk about neurological disorders. So patients with these disorders usually remain in the home for years. There are 3 main diseases which require assistance with care, attention to safety, and support for the patient and family. The first one is Parkinson's disease, a progressive disease which affects the part of the brain which controls movement. So usually you'll see the hands or the legs have tremors. Multiple sclerosis is a progressive disease which affects the transmission of impulses throughout the central nervous system. First signs are usually fatigue, emotional changes, and difficulty with speech. This usually affects young adults. ALS is a progressive disease resulting in the degeneration of neurons. And most patients with ALS will die within the first 3 years of diagnoses. So what is your responsibility? Make sure they're taking their medicines, regular exercise, report any fatigue or pain, make sure meals are high in nutrients and fiber, monitor them for difficulty with swallowing, encourage the patient to be as independent for as long as they can. The next one, the deadly disease that we all fear. Let's talk about cancer. So all of us have cancer cells in our body. It just depends on what will activate them. So cancer can occur in almost any part of our bodies. The most common sites for cancer growth are the lungs, the colon, the rectum, the prostate in men, the breast, men or women, and the uterus in women. Certain factors can contribute: family history of cancer, smoking, drinking alcohol, taking hormones, having a very poor diet, exposure to radiation or chemicals. And when you think about radiation, most of you do not think about an X-ray. So if something hurts, you want it X-rayed. Science has shown that repeated exposure to radiation in high doses can cause cancer, as well as exposure to too much sun. So cancer can be in the form of a tumor, or it can spread to other parts of the body. Benign tumors don't cause death. They grow slowly and in certain areas. They're considered to be non-cancerous. Malignant tumors grow quickly and aggressively, and they're considered cancerous and will cause death if left untreated. Metastases is when cancer spreads to other parts of the body from where it originally developed. Treatment options for those with cancer depend on the type of cancer, but it can include surgery, radiation, or chemotherapy. So what is your role in the patient with cancer? If your patient, it depends on the type of cancer. If the patient is discomforted because of side effects from treatment, we'll need to make sure that they rest, they get fluids, and they eat something. Encourage patients to eat small, frequent, well-balanced meals during their treatments. Pain can be controlled as part of their plan. There's also other things that you can do for pain other than a pill. So let's talk about the last one, which is chronic renal failure. And chronic renal failure is when the kidneys no longer function as they usually did. Waste products are not removed from the blood, and fluids build up in the body. A patient with renal failure will become very ill. Signs of chronic renal failure are leg cramps, bruises, twitches in the muscles, loss of appetite, skin issues such as dry, itchy, thin, or brittle skin, yellowing skin, hypertension, and oftentimes congestive heart failure. Treatment for chronic renal failure includes restricting fluids, changing the diet, medications, and dialysis, which removes waste products from the blood, and then potentially a kidney transplant. So what is your role? Make sure that your patient is resting, eating well, and watch how much fluid they're taking in. You also have to think about safety, because patients with chronic renal failure can have very abnormal bleeding patterns, which means if they get injured, they may bleed a lot. It's also good practice to weigh the patient each day to ensure fluid retention is not happening. So these are just some of the most common diseases that you may see. There's certainly many, many more, and it's beneficial to familiarize yourself with those you encounter the most. And since you're not practicing yet, you do not know what those are. So start thinking about these diseases and potentially some of the other diseases as we head into your final project.